Hi, I'm Dr. Janet Pope on Monday at the virtual ACR 2020, welcoming you to At Room Now. I'd like to talk about osteoarthritis. There was a really lot going on today on osteoarthritis. It's almost the belle of the ball. So the first abstract, number 1650, it was a really neat trial, a small but interesting trial, double-blind, randomized controlled trial to look for primary knee osteoarthritis comparing intra-articular steroids with methylprednisolone acetate at 40 milligrams plus 1 cc of lidocaine versus 2 cc's of lidocaine. They gave the preliminary analysis. They planned 32 patients, but they have 27 already with very strong results. As you might suspect, it was mostly men, and they looked at the knee injury and osteoarthritis outcome score, or KOOS. And already with only 27 patients, the p-value was strong, 0.007. What improved? Pain, function, and quality of life. The other neat part was that this was a factorial design. So they also randomized patients to some kind of social media intervention and maybe a wearable device. They haven't reported on that part. But the reason I chose this trial is it shows IA steroids are better than lidocaine alone, number one. Number two, it also showed that in a small trial in clinical care, you can do a trial like this, but you can also answer another question and we'll find out if people move more, if they're given sort of cues to move. The next study, just in brief, was number 1652. And what it was looking at two cohorts of primary knee osteoarthritis, again, mostly men with a large N, almost 800 patients. And what they did was they were looking at patients who got intra-articular steroid injection of the knee or hyaluronic acid viscosupplementation of the knee. And they looked at two questions. Is there more X-ray progression leading to knee replacement if you received one injection or one course of either or multiple injections? And the bottom line, fortunately for us and our patients, is that there is no difference of X-ray progression or worsening your knee OA comparing IA steroids to IA viscoelastics. I think it's an important take-home message. The next one was, if we lose weight, will we help knee osteoarthritis? That is in the ACR recommendations and it is well known. So this was an interesting little study, preliminary results, number 1656, looking at bariatric surgery and offering patients either bariatric surgery or consideration for a knee replacement for the morbid obese patients who had significant knee osteoarthritis. Although not randomized, and the ethics of randomizing would be difficult, it does trend that if you get bariatric surgery, your knee OA does improve a bit. So that's another benefit for those patients. The final one, number 1649, was looking again at intra-articular steroid injections and doing a gait analysis. And the bottom line was, in this study, it looked like quadriceps was better off if you had an IA steroid for primary knee osteoarthritis, and your gait did improve. So I think the totality of the benefit are that we have things to offer our patients, including intra-articular steroids for knee osteoarthritis. Thank you, and please follow us at Room Now.